not necessarily those of this station, its staff, management, or sponsors. Welcome to Different Like Me Culture with your host, Alyse November, a licensed clinical social worker for more than 21 years, who brings a brand new approach to learning by providing hands-on, interactive, web-based lessons that are easy to use and implement, and focus on some of the most important topics in today's society: bullying, dementia, special needs, relationship issues in 55-plus communities. These 4 topics are the focus of the Different Like Me Culture program. For more information, call 561-270-2280 and begin your pro-action approach towards these major challenges in our community. Call 561-270-2280 today and get started. Now, here's your host, Alyse November.
Hi, welcome to Different Like Me Culture. I'm Alyse November, and I'm joined here today by Karen Green, who is a professional guardian and a care manager, professional care manager, And today we're going to be talking about care management issues, guardianship issues, a little bit of this, a little bit of that. If you have any questions, you could call us at 888-565-1470. And let me first introduce Karen. Karen, I love. I've known her for many years. She's absolutely amazing at what she does. We've actually worked on a case together recently, so I've gotten to experience that firsthand. But as I said, she is a professional care manager and a professional guardian. She has a company called Hired Hearts, and that is exactly what they do. They take care of people when they are in need. So if you have a relative that's living out of state, living here in Florida, and you live up north, perfect opportunity to hire Karen to help you take care of your loved one who's here. She kind of is like your eyes and ears, right? You do things like go to the doctors, help them. You're going to talk all about all of that. But she does wonderful things. She's also president of the Palm Beach Guardianship Association. And what else am I missing, Karen?
Hoarding Task Force for Palm Beach County.
Yep, you're on the where we sit on that together, although you're much more active, yes. And that's a very interesting group as well.
Yeah, it's a pleasure to be here.
Yes, thank you for joining me.
Yay.
So let's just talk a little bit about care management and just kind of explain what it is so our listeners know what it's all about and the types of things that you do. And why don't you go ahead and just talk a little bit about that?
You know, I started my company 13 years ago, and I saw in the world of orthopedics the need for people to have an advocate, a strong advocate, someone who would make sure that they were placed in the right facilities and that they wouldn't end up with decubitus ulcers or wound infections after a procedure, that they would be able to follow up with their doctors and get their pain medication on schedule. Make sure that, they were eating properly and not dehydrating. Mm-hmm. So these things were really important to me in that world. And then I decided to branch out into the rest of the world, Alzheimer's, dementia, cancer patients, people with depression. There are many aspects where a case manager can be beneficial. And I like to take it from a nursing aspect. So many of the issues are medication related or, specifically more medically based. And we are a strong advocate. Mm-hmm. I'm very passionate about what I do.
And I think sometimes it makes a difference because I've worked with other care managers who are more on the social work end of it, and I'm a social worker myself.
Absolutely.
And having a medical background, I understand a lot of what you do. But you've taught me so much just working with you, with my patient, where, I would make more of it's okay kind of thing. And then you're like, oh no, we need to take care of this. And, the social worker in me isn't typically an alarmist, and not that you are, but you look at things with more of a medical model.
And I'm very proactive. I'd rather tackle something up front than have to really handle a disaster. Mm-hmm. So, my goal is to keep people successful and healthy and swift recovery. Mm-hmm. That's the goal. Mm-hmm. I can work with somebody for a short period of time, get them through a medical crisis or a medical situation, kiss them on the cheek and wish them good luck, be well, and call me if you ever need me. And then there are others that I work with through a lifetime,
Ongoing.
ongoing until
forever.
they pass.
Uh-huh.
It depends on the situation and the need, but it's always good to know that you have someone. There are many people who don't have children. Unfortunately, some people outlive their children, and their families become scattered, and there's just no one to advocate. So I try to keep in the world of case management because that would be the least restrictive environment. And occasionally I'm called upon to do the guardianship world, and that's a more restrictive environment. But it's still being able to do what I am passionate about, and that is to help people live their lives as independently as possible.
Mm-hmm. And I know that you do that. I know I play
Dignity.
Karen and I play mahjong together with two other girls, and I know that she takes calls like all throughout the mahjong game.
Oh, yeah.
There is no sleeping for you. I'm guessing you get calls all throughout the night as well.
I had a call last night at 10 o'clock, and she called me back at 6 a.m. this morning. I really, for all who are listening, I really try to keep boundaries and keep it within the Monday through Friday business hours. But if there's an emergency, I want people to know that I'm available.
It just kind of is what it is. I mean, in my practice as well, if I have a patient that's in crisis, I just tell them, listen, if you make it wait till I see you next week, then I need to be here and help you through it, because sometimes the moment is gone and we lose what you need. And especially with you, I mean, if somebody's in crisis or not doing well, or you're always on. We're always on call.
Absolutely.
I guess in this profession, 7/24.
And I also take my own call. I have my phones forwarded to my cell phone, which makes me accessible wherever I am. I don't have an answering service that needs to be screened and filtered and then deviated to me at some other time.
Mm-hmm.
So I can handle it when the time comes and deal with it effectively. And that way everyone has a clear understanding of where we are, and there's no
Right.
misunderstanding.
Right. So why would, I know we've covered it a little bit, but why would somebody need to utilize a care manager? And then maybe we could also say guardian, because sometimes it gets confusing for people saying, well, what do I need somebody in there for? But I know, as I referred somebody to you, recently, and we've worked on this case together, I mean, it's just such a benefit. But why don't we tell our listeners what's the benefit of having a care manager in there?
So many people who I work with don't see the need. It's typically the family. I mean, the ideal client for me is a family who lives up north or away. The mother and father are here, and they've had some medical issues that can become very complex very quickly, and there's no one to help manage it. And then sometimes things can get very escalated, and we end up in an adult protective service situation where the state's called in to troubleshoot and help manage a situation, and you never want things to get that critical.
Mm-hmm. Yeah.
I've had some very successful stories. I had a woman who, her family would come down from up north every 6 weeks to clean her home. And there were palmettos, and, she was not living in a very healthy environment at all. I mean, they were flying in the house. Mm-hmm. They were crawling on the floor. But they would come in every 6 weeks clean. They had somebody to bring her food in every day, and they thought that she was okay because she always would say, I don't want to leave my home.
Mm-hmm.
And she would throw the caregivers out. So Adult Protective Services ended up on the case, and, they made the family understand that it's not okay to leave her independent any longer. She's not capable of being independent, and if they continue to leave her independent, that they would be brought up on charges of neglect.
Mm-hmm.
So once they had a full understanding of the scope and the ramifications, they contacted me, and we were able to bring in, through other entities, private duty caregivers, and ultimately it still was not a safe or healthy environment, and we needed to move her out. She went into skilled nursing. She's doing beautifully well, and she has the medical attention she needs. They were able to go in and renovate the house and visit her as often as possible. Mm-hmm. And it's turned into a major success story.
That's great. And
Yes.
You brought up a really good, interesting point, which is when family is up north and they reach out by phone and, hey, Mom, how's everything? And what does Mom typically say?
I'm fine.
I'm fine. Everything's okay.
Everything's
okay. Oh, great. How was your doctor's appointment, Mom?
Fine.
Oh, great. Fine. And, we talk about one of the issues that through different like me culture that we address is dementia. And
So mom is not fine. Mom
Mom is
hasn't
not
showered.
fine.
She
Yeah.
hasn't changed her clothes.
and how do you
Her
know?
food is probably rotting in her fridge, but
Yep.
she thinks it's fine, so she's going to keep eating it. If she's driving, she probably should not be at that point. And there are a lot of very scary things that happen.
Right.
You know, people that don't take the proactive measures or don't see it clearly. When it's your family, it's much more difficult to see it clearly and to take the appropriate actions. You don't want mom to get mad at you or dad. I mean, we're being exclusive to mom here, but it happens with dad. And it's even, I think, more difficult with a father who's always led the family, been the breadwinner, and your children, I don't care how old you are, your children are always your children.
Yeah, and it's hard. It's hard to change roles from
Right.
child to parent.
Absolutely.
And that's kind of what you have to do.
And
Is,
someone
is
as
take
an outsider,
control.
you know,
Yeah.
it's so much easier for me to help coordinate the care and step in and do it on a much friendlier basis instead of a more adversarial, you know, you're still my daughter and you don't have the right to tell me. It's different when an independent outside person comes in and helps. I'm
Right.
not there to take over. I just want to help make it successful.
Right. And I know the case that we shared. You stepped in only as needed. I mean, I still went in to see her and took care of her and, you know, just take care of those emotional needs. But
We are there to ensure safety, health, and success. You know, it's always operating on a least restrictive environment. If we can keep you home successfully, that's our goal. Sometimes people need more socialization. They're very isolated. I'm sure you see that.
Yeah.
You know, they come home. If they're starting to get forgetful, a lot of their friends will not want them to join in on their games or bridge or canasta. They can't remember the plays. They can't remember the cards. It's difficult for them to do that and keep up. And it also is a mortality check for those people. They see their own deficits and it's very difficult, so they'd rather push it aside and not deal with it. And I know we've talked about elder
Yeah.
bullying. That's a whole nother conversation. But then people are isolated
Yeah.
and they stop eating sometimes. You know, they're
They
not
get
taking their
depressed,
medication
They feel
properly.
lonely, right? And they're isolated, so nobody knows really what's going on. And when the kids call from up north, we just, you know, oh, how is everything? And they say good. And a lot of people can pull it together for that 5-minute conversation.
Yes, because it's so familiar.
Yes, yes.
And that's always the standard
Yeah.
answer. I'm fine. Everything is fine.
Right. But when you're unsure or unclear and you're living in out of state, I think that utilizing a care manager is the way to go, because you could just say, hey, let me just go in and do an evaluation. Let me let you know what's going on. Your evaluation, I sat through your evaluation and I was just so super impressed. I mean, it covers
you.
everything from just soup to nuts. I mean, when I do my evaluation, we kind of just mostly take care of the psychological piece and we always ask about the medical. But yours was so thorough. And you looked in the fridge and you looked at the feet and you looked in the bathrooms and you just get up and do what you got to do. I mean, we do that a lot of times when we're in the home too. But
Right,
you
as
really
soon as
did
you
it
walk
so
in,
depth.
You start doing your assessment
Right,
the minute
you
you
just
walk
look.
in.
You know, what's up
you
with
know?
the carpets? Are they walking with a walker? You know, I mean,
How are
we're
they sitting?
trained.
Is it safe? Are there
Right.
carpets that are going to trip them? Nobody wants to have a fall. You know, that's never a good day for anybody. And, you know, to the medicine cabinets, checking their medication to see if it's expired. Are they taking the right pills? How many pills are, you know, similar names, similar interactions, and you really have to know what you're taking. One doctor will give one thing for one, and then the other doctor gives something, and then they don't interact well.
Right.
It's always important to make sure you get your medicine filled at the same pharmacy. Some people go to different pharmacies. They have mail away. And people won't, the pharmacist won't know what you're taking and to put that
Right.
comprehensive list
Right.
together.
And
Pain
sometimes the doctor
medication.
doesn't, because if you go to different doctors and, you know, you go to the
Absolutely.
gastro guy and he gives you something that might interact with something else that you're taking. and-
Neurologically that you're taking.
Yeah.
You know, if you
Yeah.
take Aricept at night, it could cause nightmares. So having that knowledge and being able to talk with the people and the family and the caregivers to find out what their situations are, tweaking little things can sometimes make a huge difference. Sometimes it's a urinary tract infection that's causing the confusion, and you resolve it, and they're alert and oriented once more. So it could be very simple things
I mean,
to make
that's
a
just,
huge
that's
difference.
just a really good tip. That's a really good
Think
tip because
so?
I have a lot of my patients that
How many
suffer from
brown,
nightmares.
white tablets do people have? Round white pills, and you're
Yeah.
like, what are all these for? And they're like, they don't know. The doctor just told me to take them.
Right.
So
Exactly.
we
and then
can
the
set up
question is,
medication
did I take
dispensing.
them? Did I take
Oh,
them?
yes.
I know I used to work with a gentleman who has Alzheimer's, and or he had kind of mild Alzheimer's. And then what had happened was I would set up a calendar, so I would make him make a red mark if he took it in the morning and a blue mark across the calendar date when he took it in the at night.
We can
And-
help put the medicine in a
Yeah.
med box for them. There are also medication dispensing units that will drop the pills and send out reminders. And if they don't take it within X amount of time, the pills go back in so they can't overdose on medication, especially if people are a little more drug seeking. We work with a whole host of clientele from, I would say 25% of my clients are under 70, between 45 and 70 years old. So you don't have to be the frail elderly to have a situation that needs help guiding you through. So, from depression to drug abuse, alcohol abuse, a medical, say you've had a car accident with a major traumatic brain injury. You broke both your elbows. We had a lady once, she fell off a ladder, had both of her elbows fractured. She could not move them. She said, I just want to be able to wipe my own tush. That's a really simple thing, but it's difficult, and it took weeks. And, to bring in the support services, the caregivers, and make the doctor appointments and make sure that, she had everything that she needed.
Yeah.
Was really important.
Because you'll go to the doctors too. You go to
We
doctor's
do.
appointments
We
with
do.
patients too to help.
I always make sure we have our questions written down for the doctor, and that way we're able to be quick and concise, and the doctors love that because we, have questions and they can provide answers. And I write the answers next to the question so that the client can refer back to it. We can discuss it later in case they forget. Or, there's so much to cover sometimes in an appointment. Sometimes it gets a little overwhelming to get all your points out. We want to make sure that we can get that done.
Yeah. And you mentioned that it's not only the elderly that you work with, it's anybody.
Absolutely.
Anybody. And that's important too, because I think a lot of times care management is associated with somebody who is older.
Senior.
Yeah.
Yeah. Well, we have such a huge population in Florida, but those are just not the only people that need assistance. I've had a few people that have attempted suicide. There are a few people that have been, the same realm, have been Baker acted, and they just need some guidance to get through it, set them up in successful environments. Again, I take it from a medical background. I'm not doing therapy. That's not my realm. I make that referral. But if you have enough support services in place, people can be successful, and that's the goal.
Mm-hmm. That's
the
great.
goal. Regain their independence and, be as, as socially satisfied as possible. I think that's huge.
So we're here talking with Karen Green from Hired Hearts, and we're talking today a little bit about care management and guardianship. So I know we've spoken a lot about care management, and I was always confused about guardianship until I guess you've kind of set me straight on that. I'm still a little confused. I'm a little confused about everything. So that doesn't really matter. Nothing really sets me straight. But guardianship as opposed to care management, because guardianship is more like the judge says this has to be and this person must make decisions, and
It is.
as opposed to making a choice to do it.
It's a
But-
much more restrictive environment. Usually there's someone who, there's a question of capacity, whether they should be able to make their own decisions in a multitude of areas. It could be financial or medically based. Again, you always want to go least restrictive environment, but if there's a problem and the courts step in, Adult Protective Services sometimes are the first leg of people who get involved. They see a situation where a person does not have capacity or allegedly does not have capacity, and they need to go out and explore that further. So there's an examining committee that's appointed, and that will consist of 3 people to go out and do their own assessments and talk to doctors and local people who have dealt with that client, whether it be their other physicians or friends, neighbors, to get a picture of what's going on for that person. And they take their medical history, and then they make their report and recommendations to the court, and then the judge ultimately decides whether it's a guardianship. And there is a guardianship of a person, a guardianship of the property, or what we call plenary guardianship, which is guardianship of both property and person. And that's the ultimate restriction. Usually all their rights are taken away, and even if they are still able to communicate and walk and talk and be successful in their own way, they won't have the ability to make decisions. So
Well, if they're not, if they're
that's
not able to.
right. That's a difficult place to be in because, they want to continue and, maybe they're making very poor choices and they need somebody to guide them. So it's a very delicate place to be.
How do you help somebody? Because I'm guessing on some cases you're just appointed, and some cases it's kind of planned that you're going to be the guardian. And I'm
Sometimes
guessing that
it's
somebody's
voluntary. I had a client who, was in a very difficult family situation. I mean, not every family situation is wonderful, and he had no one that he could really rely on, and he was making some difficult choices, and he was afraid that maybe they would declare him incompetent somehow, and so he did a voluntary guardianship, which, we did successfully for a while, and then I stepped down, and, he took his life back over. So, it doesn't always have to be permanent. And that's, a thing I'd like to really make sure everybody understands that, some rights can be restored. Sometimes all of your rights can be restored. I have a client who I work with as a care manager. He has 2 sisters that are working with him as a co-guardianship, which can be difficult at times, but he's done beautifully well. And he's would really prefer to have his rights restored and is petitioning towards that goal. So it doesn't
That's
always
great.
have to be an end all. Which is nice.
Yeah.
We like success stories.
Right. And that's great, is that it's not, when somebody's rights are taken away, I guess it's scary.
Absolutely.
How do you do you get resistance from people?
I get resistance from people. Sometimes I get resistance from the family. I have a young woman that I'm working with now. She's 62, and she doesn't understand why she doesn't have her rights. Actually, she petitioned the court to have her rights restored just last week, and the judge restored 2 of the rights that were taken away, of the many that were taken away, but 2 were restored, and she was not satisfied with that and wants to appeal. But, unfortunately, that was the final decision by the judge.
Must be a scary place to be in.
It
to
is.
say
It's sad.
Because it's not only that you're deciding, well, I'm going to have this person tell me when to take my medication, take care of all of these needs. But
Even
also,
living in their own home.
Right.
She wants to go home, and that's not possible. The home is not habitable. And, so we're not able to do that for her, and I'm terribly sorry about that. I wish I could make it so for her, but it's not possible. So.
Yeah. I know, 'cause speaking about habitable, and you mentioned the hoarding task force that we're both on.
Yes.
I know that sometimes that could be a major issue, and is questionable as to whether somebody is capable of managing their own lives if they're living in, I guess, a situation that is really uninhabitable to the rest of the population.
Correct.
And we know that hoarding is a disorder. We know it was newly added to the DSM, so thank goodness for that. It's not part of OCD anymore. They have their own section because we know it's a real disorder. We know a lot of times it comes as a result of stress. A lot of times it's because of death in a family, and people just feel like they're losing control and they need to hold on to stuff to kind of get control.
Absolutely.
And I know that you've worked closely with a lot of people in the hoarding task force to help people to kind of help to get their, as you were mentioning before, their homes back together, their lives back together, and get in the resources that are needed in order to start to live a little bit of a healthier life, including the psychotherapy piece. Because,
Absolutely.
I always say with the hoarding,
That's
the
a great
psychotherapy
referral
piece
for me
is
to
the
give to
first.
you.
Yeah, well, you take care of
That's
the
out of
crisis,
my realm.
clean it up. But yeah, and when you're dealing with somebody with hoarding issues, if you don't take care of the emotional and psychological piece, then what happens is we could clean up the house, but guess what? In 3 months or less,
It'll
it's
be
back,
right
to the
back.
same because you haven't helped them work on their issues.
Right. And I try to keep within my scope of practice and know when the referral is necessary. And I think we really pride ourselves on doing that, to bring in as much support services in the appropriate way as possible.
Yeah.
Because I don't do the psychological piece.
Right.
I mean, in every nurse, there's always some therapy, I guess, that you have to do, but I really like to refer it to the
Right.
professional because
And I
that's
was
the
thinking,
right referral.
I was thinking the same thing. being a social worker, and I
Mm-hmm.
guess not a psychologist, not that I'm bashing psychologists, but I think we're the better profession. So my husband's a psychologist. So, but anyway, I always think we're better because we take care of the whole person. So I was thinking the same thing is because when we go in there, yes, we look. If there's empty pill bottles on the table, I'm going to shake them. So am I going to pre-fill a box? No. A med box? No. Am I going to go with somebody to the doctor? We know where our limitations are as well, being social workers, doing the psychotherapy piece, but as well, kind of when we work in the patient's homes, you can't not smell things and see things. You kind of become a part of their lives.
Well, that's when you know you're doing your job right. I mean, to be aware of what's going on in the environment that you're in with your client.
Absolutely.
You know, because even though you may not do it, you can still make that referral to somebody who can.
Yes. So I have a question for you.
Yes.
So what's your biggest pet peeve, like with, like, I guess issues that you deal with? You know, so I guess it's about, this is about, I guess, educating the community about what you do. But I think it's also about making the world a better place to live in.
I would
and
say
sometimes
the
we
number
don't work
one
together.
thing, absolutely, the number one thing that jumps to mind immediately is to have an advocate if you're in the hospital. Whether you are young or old, a child, 95, doesn't matter. You need to have somebody who will make people accountable to do the right thing always. It's huge. You know, have somebody who will come in and talk to the doctors, talk to the nurses, talk to the staff to make sure that everything goes the way it's supposed to.
Yeah, because it's a really intimidating place to be.
Absolutely.
I know I worked in a hospital for many years, in my past life, I call it, but back in New York for many, many years, a hospital that's not even there anymore, which is a little bit scary. But I know, you know, when you see somebody in their gown with their heinies hanging out, it kind of takes away the human side of who you are.
Right.
You don't see somebody like, you know, we are here at work, you know, professionals on the radio station, and God forbid we get sick and go in the hospital. We're just like everybody else. They don't know who we are. And I feel like sometimes, although I know, you know, in the hospital, we always try to treat with respect, but it doesn't always happen. And I think that's just huge, is having somebody advocate for you. Karen,
Yes.
God forbid I go in the hospital. You're
Call
it,
me.
girlfriend. You're
Call me.
it.
You know, as a nurse, I'm able to walk into a hospital and make it happen. And I think it's a wonderful thing. You know, I'm very, very excited about what I do. I can wake up every day and know that it's going to be a different day than it was yesterday. And never 2 days are the same.
And always know that we're making a difference. And you certainly do make a difference in people's lives.
Thank
so
you.
if somebody wants to get in touch with you, Hired Hearts is the name of the company.
Yes.
Why don't you tell everybody how to reach you?
My website is hiredhearts.com, and that's an S on the end of hearts. I am the hireable heart. And we have my email address, Karen Green @hiredhearts.com, and my phone number is 561-432-7800.
Say that one more time.
561-432-7800.
Right.
And it's been a pleasure being here.
Yes,
Thank you for this opportunity.
Thank you so much. It's always a pleasure seeing you. You're just so wonderful at what you do, too. I always learn something every time I talk to you.
Thank you.
So it's really
It's been
wonderful.
great.
Yeah. And we're going to have to work on that pet peeve issue. So I think that's really, really great. So, yeah.
Thank you.
Thank you.
Thank you for tuning into Different Like Me Culture with Alyse November. Join us every Monday at 6 p.m. Call 561-270-2280 for more information. And tune in again next week for more Different Like Me Culture.